Robert Wood Johnson University Hospital is and always will be a union-friendly hospital. We respect your right to organize and collectively bargain in good faith for a fair and equitable contract. We also believe that nurses are the face and heart of our hospital, so we are extremely disappointed that your union has decided to strike. Our nurses are currently the highest paid in New Jersey based on publicly available salary data. After several months of good faith negotiations, our offer would have made you and your colleagues even more highly paid than your peers. Average wages, more than 14% higher than your peers. Total year one wage increase of 7.6% and 4% increases in years 2 and 3. Innovative staffing standards with additional compensation for nurses who work harder if standards are not met. Increases in longevity bonus pay for nurses with 10 or more years of service, and more. We have offered you a very rich contract at a time when hospitals nationwide are struggling. Staffing is our number one priority today, and it will be our number one priority tomorrow. We understand that there has been conflicting information about our commitment to staffing standards. On July 13th, both sides agreed that if the terms of the unit's staffing guidelines are not met, nurses working on that unit will receive a $20 per hour differential for hours worked during the deficit. This language was mutually developed by the union and the hospital and included in the July 17th Memorandum of Agreement signed by the union and the hospital. We have added over 200 nurses to the budget to adjust for volume and acuity since May 2022, and added nearly 150 new nurses, net of attrition, since 2022. Our staffing levels are already among the highest in the state based on available data. In fact, current staffing reflects 170 more nursing positions than required by the standards outlined in staffing legislation recently proposed in Trenton. It remains our goal to reach an equitable resolution and avert a strike. No one wins in a strike. Over the last several days, we have held town hall meetings to hear directly from our workforce, with many hundreds attending. It is clear that there is a great deal of confusion regarding the terms we agree to with union leadership in the MOA, particularly with respect to the new and innovative staffing standards the parties jointly developed. Much of this confusion can be traced back to inaccurate and at times misleading communications from union leadership. We've heard loud and clear that many of you feel like this is a he said, she said situation. We agree. That is why we're willing to go to arbitration and have an independent third party act as the judge. Why is your union afraid to do this? We anticipate this extended strike will cost the hospital tens of millions of dollars over the coming months. These are millions of dollars that would otherwise be used to invest in you and your non-nursing colleagues, in wage increases, increased benefits, as well as improvements to patient care. Most importantly, we are saddened by the financial burden this will place on each of you and your families due to lost wages and benefits. For the sake of our patients, we urge you to work with us to come to an agreement and avoid a strike. If you do not wish to strike, please let your union leadership know. We are ready to return to the negotiation table immediately and hope that your union will do the same.